So you just told your patient that they can benefit from clear aligners, and they said yes. But when it comes time to pay for treatment, they say they have to talk to their significant other. Sounds pretty familiar, right? I have been in this situation countless times, and believe me, it is so frustrating. So in this video, I'm going to share with you the perfect pitch that will help you explode your clear aligner case acceptance. I'm also going to share with you the biggest mistake that general dentists make when they talk about clear aligners. So we've talked about adopting the clear aligner mindset to double your production. A lot of you understand that, and some of you feel like the process of clear aligners itself is too complicated. So we went over how to simplify it to keep it predictable, and now you may even feel a little more confident on offering it to your patients. That is awesome. But a lot of you are probably thinking, Dr. Avi, I'm doing all these things. My patients nod their head and say yes to me when I explain clear aligners to them in the chair. But when it comes time to pay, they don't. So let's take that same situation and build off of it. So the patient already agreed to the treatment in the chair, but they say no when it's time to pay. Most patients' reason why they say they don't do it is because price, right? Oh, it's too expensive. This is very common, and it's an unfortunate realistic barrier that we all have to experience. I used to struggle with this as well, and over time I used my experiences to figure out the best way to close the sale, and I created the perfect pitch for preventative care through clear aligner therapy. Let's back up a bit so I can share with you how I created the perfect pitch. Now, when I started with clear aligners, the practice I was in had just about every variable working against me. Let me paint a picture of what this looked like. First of all, the practice was old. It was older than me. The decor was early 2000s comfort. Back in the early 2000s, this was probably the place to be. It's that classic clinic that your parents would feel at home in. The demographics were state employees, working class, super nice people. And the average age was about 50 to 60 years old. And I'm the new provider in the office, the young one, right? I was replacing a dentist that was there for over 20 years. The previous dentist was not offering aligners at all. And the patients trusted him, but not me so much. So you have to remember, people don't respond well to change, by the way, especially patients. So if you are currently in or have been part of a transition, you have to know that patients will always have their guard up, and you didn't do anything wrong. This is just how the human psyche works. What that means is you have to work twice as hard just to get their guard down. That way they can trust you, and then they will eventually be open to accepting treatment from you. So now imagine all these variables that I mentioned to you just stacked against you, and you're trying to get case acceptance for a $5,000 treatment option. Oh yeah, and you're also probably the first dentist to recommend this to the patient. You probably have one thing in similar to me in this situation currently in your practice. So like I said, I was determined to make clear aligners work in my practice, and I wanted to bring this along in a sustainable way. So I started by educating my patients, but I was educating in a way that most dentists do when they first start with clear aligners. This is the biggest mistake that dentists make. Every successful aligner dentist has made this mistake, myself included. When I was talking to my patients, I was talking about straight teeth, and I was focusing on the cosmetics. I was saying things like, oh, we'll make them straight. Ooh, we'll make them look nice. Ooh, we'll get you that beautiful smile. This was exciting for me because I felt like I was going to make a difference in their lives. Don't get me wrong, patients love this idea, but what would happen is the patients are all excited and on board when I'm talking to them about it, but then when it comes time to pay, I wasn't getting that many case acceptances. How many of you can remember saying some of the same stuff to your patients and getting the same result? It's frustrating, right? Like, this makes so much sense. Like, why are my patients not accepting this treatment? And so I would think, what am I doing wrong? And I realized that most patients don't actually care about what their teeth look like, especially in a working class practice. Like, they really don't care. They will act like they do. And I mean, honestly, some of them will be real with you and say, Doc, I really don't care what my teeth look like. I just want to make sure that nothing is wrong with them. Now, one thing to remember, when you try to sell to someone who doesn't want to be sold to, this is where you come off salesy. This is dentist's number one fear. And I totally get it, because I don't want to be salesy either. Nobody wants to be salesy. And I'm going to share a story with you where I was so salesy without even knowing it. You may have done something similar. I was doing a hygiene exam, and there was a patient where they had clear signs that they were grinding their teeth. And instead of asking them if they are aware that they grind their teeth, I told them that they were grinding their teeth, and I told them that they needed a night guard. And I continued to tell them that what a night guard was, how it was made, what records we need, how much it would cost. And I did all this without even asking them if they were aware of the problem, or if they would even like to hear about it. And what happened next? After I was done with my night guard monologue, the patient looked at me and said, Doc, I used to grind my teeth as a kid. I got a night guard a couple years ago and I wear it every night. But thank you for trying to sell me on something I already have. this was so embarrassing. I was so quick to dive into pitching the patient on a night guard for a very real problem, but I didn't slow down to just bring the patient into the conversation. This is the easiest way to come off salesy, and I still remember feeling that way. I realized that situation was created because I was trying to sell them something they already had, thereby they didn't value this. They didn't value another night guard because they already had one. And now this is an extreme example, but I didn't know how to gauge their values, so I got to experience an unintentional, slimy, salesy experience. And it made me not want to talk about it with the next patient. And it really puts you in a bad headspace. And it's a big reason why a lot of dentists are afraid to some degree to talk about more treatment with patients, right? We get a traumatic no from the patient and we carry that over to the others who probably would have been willing to say yes if we actually took the time to talk to them about it, right? Sounds pretty familiar. You've been in this situation before. Well, we have to realize something. As dentists, we often get compared to car salesmen when we would like to get compared to physicians, right? Everyone knows when the physician tells you to do something, there is no bargaining, there is no questioning. Most people just do it. Why is that? Well, it's because they understand the importance of the treatment and how it's related to their health. So people rarely question it. The same goes for dentistry. The problem is we don't actively take that approach. And dentists have a bad reputation for upselling things and recommending optional treatment. So people already assume that they don't need it, and the bias gets confirmed when that dentist is just trying to sell them something that they don't really need. This is why when you take the time to talk about clear aligner therapy and how it can improve your patient's oral health, people are so much more willing to say yes, and they do. It all starts with education. This is where you have to actively build the value of the treatment. In my experience, you really want to hone in on the oral health. Try to stay away from the cosmetics. It's okay to be a little bit dramatic when talking about the oral health, and you do this to create some urgency. Otherwise, the patient's going to keep putting it off. You can say things like, sure, your teeth won't fall out tomorrow, but if your teeth stay in this position, your gums will stay inflamed, the bone loss will get worse, and in the future, chances of your teeth getting loose and falling out are going to be very high. You see how everything I said there was true? And I actually created some urgency for the patient to take action. This way they could avoid a bad decision today for something in the future. Next comes the frequency of the pitch. Talk about it at every appointment. You have to remember, patients have lives outside of coming to the dentist. Sometimes they forget what you said last time. There's no harm in educating consistently. Sometimes patients need time to think about treatment, and these consistent reminders will help them eventually come to say yes. Building trust also is key. In the practice that I worked at, I had to be patient with building trust. When you're the first dentist talking about clear aligners with your patient, this might throw some of them off. Think about it for a second. They came in for years seeing a dentist, or maybe they saw you, and they were never told of these issues of misalignment and malocclusion. Now all of a sudden, they need to pay $5,000 to fix a problem. That's okay. It happens. Be patient and trust the process. So in this situation, if it was a different dentist who you are replacing, you reassure the patient by saying that you have taken additional training to learn about treatment options to help provide comprehensive care to your patients. If they've been your patient, say the same thing. Say you're constantly learning about new treatments and techniques to provide the highest quality of care for your patients. So when you prioritize oral health, you create urgency, educate, stay consistent with your messaging, you will notice that your cases will explode. So if you're still interested in someone who wants to learn more about clear aligners, check out the next video in this series. Also, if you're interested in getting a free resource to learn how to implement clear aligners, be sure to sign up for my free masterclass. I walk you through step by step how you can start 3 more clear aligner cases tomorrow. The link for that's in the description below. If you enjoyed this video, please don't forget to drill that like and subscribe button and share it with any dental colleague you think may benefit from it. My goal is to share as much free value as possible with fellow dentists so that way we can learn and grow together. Thanks for watching. I'll see you in the next video.